Well, hello. Thank you so much for taking a moment to listen into our conversation and being a fly on the wall. So I'm here with this amazing woman, Rachel. I'm not going to steal your thunder, Rachel. So can you introduce yourselves to us and tell us what you do for the amazing county of North Somerset? Over to you.
Absolutely. Oh, welcome and thank you. Yeah. And my name is Rachel Faulkner. I'm currently working with North Somerset Council. And my background previously is I've worked in the NHS for over 20 years, all around the health promotion and prevention agenda. I'm passionate about health promotion, prevention, specifically health and wellbeing around physical and both mental health. And for me, the workplace is a fantastic setting to really enable that. So I'm working with North Somerset Council now to set up a new Healthy Workplace Award programme, and I'd love to tell you more about that in a moment.
So hang on, let's just rewind. 20 years you've been doing this. What actually got you into this aspect of health? Talk to us about that.
Yeah, so I did my degree in exercise and health rather than the sports side, because although I love my sports and being active, I felt there was much more benefit from sort of being active. So my medicine for my mental health, for example, is always being active, being in outdoors, trying new things, connecting with friends by walking or, surfing or whatever it might be. And I just really, am passionate about that. So I sort of went down that route, and then I joined the NHS and part of the health promotion unit. And there we started working around smoking cessation in the workplace setting. And then very much then worked as a health promotion specialist in Nottingham, actually, working with GPs and primary care to look at that prevention. So I work very much with practice nurses and teams to try and look at that prevention, everything from trying to encourage people to come in for their breast screening to guided health walks from the surgeries and all those things. And then just got into the staff wellbeing then, because I felt that, we're always patient focused. We do so much for our patients and our customers and clients, but actually, and as the same in schools and teachers, but actually, if we look after ourselves, I know if I look after myself, I'm a better mum, I'm better at work. So for me, really passionate about looking after the health and wellbeing of staff. And I think within the NHS and the healthcare setting, we're all such givers and carers, but actually we've got to look after each other more. And I think that's where the workplace for me is such a great setting, and love, to work with you guys, really.
That is just fantastic. Good. There's an interesting saying that I've always loved since I heard it, which says to actually win the environment around you, you first need to win the workplace. And so you can't do anything around you if your employees, your team, your partners aren't actually able and well. So that brings us to what we're going to talk about today. So in terms of the workplace, and what is it that you offer? Just give us an idea of what it is and how that benefits specifically people who work in the health sector.
Absolutely. So in North Somerset, it's been fantastic that the public health team within the council have recognised that workplace as a key setting. So I've been asked to set up a healthy workplace programme. So for the last sort of 5-6 months, I've been working with 6 to 7 organisations, businesses in North Somerset, to really find out what would help them. Like you say, what offers they need, what support would really enable staff. And obviously, they're all part of the community in North Somerset as well. So we've developed a Healthy Workplace Award framework, and that covers everything from getting key leadership, people like yourself who are really passionate about this and want to care and look after the staff, through to the environment in which we work, to actually asking staff and engaging them about what would make their working day better. And then we look at a range of health topics specifically around mental health, women's health, men's health. And the idea of this award framework is that each organization can actually do like a little audit or a baseline of where they're at already. And I think often we forget what's already in place to support. And for me, it's about preventing, promoting and supporting. So not just sort of the health and safety angle, but much more than that now, like promoting that health and seeing that workplace as a really key setting, because, we spend a lot of time at work, over 60% of our waking hours. So really, really important setting. So the framework then is, to hopefully enable to capture what already you're doing really well, and then maybe some areas that we've not really looked at before, or some gaps that you think, do you know what, that's something that we'd really like to focus on. And then, hopefully with our support and the staff engagement, we can really make a difference. And I've been working with a range of partners in North Somerset. So we've set up a healthy workplace collaborative, and that includes some of the local chambers of commerce, the North Somerset Enterprise Agency, the economic team, as well as all public health specialists around different topics, and all the key partners who are just generally interested in this, to try and collate and hopefully continue to build on a range of wellbeing offers. So, for example, we work with Thrive at Work to look at mental health training for line managers. So again, we can increase their knowledge and confidence in how we support staff, and again, just trying to be proactive and preventative. So a range of offers from, mental health to physical activity, working with leisure services, to men's health, working with the men's male stakeholder group and talk clubs locally. And again, an area I'm really passionate about is women's health. And I know in healthcare, we've got lots of women. And another key area, I think, which often, we always sometimes overlook, but so important, is our musculoskeletal health. So again, a range of stuff, but the really important thing about hopefully the program is it's flexible. It's about the needs of each organisation and how we can support you and your staff, and how staff can, acknowledge and look after themselves as well as colleagues to make that working environment better.
Gosh, there's a lot packed in terms of what you can offer, from the preventative right through to the support of it, which is absolutely exciting. So let's just play devil's advocate here. I am a team member within our environment. How does what you've got to give benefit me? Okay, how does it benefit me?
Absolutely. Well, hopefully as a team member, within your team, you might recognise that, people are struggling around pressures at work-life balance, those sorts of things. So it might be that we need to, bring in some short bite-sized training to offer around mental health. What I love to have is like health champions in each team, or a mental health first aider. So again, rather than it all being on the line manager, you've got some kind of connection with another avenue of support. And hopefully these guys, then, we're not expecting them to be experts, but what they could do is, they'll have some training and an acknowledgement of all the signposters locally, so we can get people help when they need it. It really is okay not to be okay, especially following the pandemic. And especially in healthcare, you guys have worked so incredibly hard, and it's about those. It might be simple tools, ensuring that as a culture an organization has and they do take lunch breaks, keeping hydrated, absolutely essential. I've done so many work in workplaces where we've done some measurements, and often 70-80% of healthcare staff are dehydrated, and yet we're always talking about patients by hydrated. So little simple tips, small changes can make a big difference, but it's about what that team member would like, and hopefully it'll be about improving their own health and well-being, as well as the team and the organisation around them, to really hopefully have a more positive culture going forward.
That's just amazing. And what is the cost to Peer Health Exactly? Tell me about that.
Yeah, it's all free.
It's all free. That's what I wanted to hear. It is
absolutely
free.
Yeah.
Now, with any organisation, I think would be absolutely bonkers not to take this proposition and this amazing project that you're doing on behalf of North Somerset. We appreciate you. We are absolutely going to be grabbing this like you have no idea in our organisation. I will make sure that we engage with everybody, and everybody's aware of that, and we'll bring you in to help us to do this. So thank you for your time. We've just realised we're both in pink today.
Yeah.
Rachel.
Must be the pink day today.
It must be a pink day today. It must be a pink day today. Rachel, it's been amazing meeting up with you. We thank you for all the work that you're doing. It is such a great cause, and we are privileged to be able to be tapping into this, because of course you're right, from a healthcare perspective, we're always looking after people. We think about ourselves last. So thank you so much, Rachel.
Thank you, Brandy, and thank you. And I really hopefully look forward to working with you and your team. It'd be an absolute pleasure. Thanks for your time.
Thank you.